Hi, today we'll discuss about the attachment on the humerus. First, attachment on the upper end of the humerus. This is the upper end also known as the insertion end of the humerus. So first, this is the small elevation on the anterior aspect of the upper end of the humerus. This is the lesser tubercle. So lesser tubercle will provide the insertion will provide the attachment or insertion of the subscapular muscles. Now, this is the large portion on the lateral aspect of the upper end of the humerus. This is the greater tubercle. On the superior aspect of the greater tubercle, there is a three impression. This is the three impression. The three impression for the supraspinatus, impression for the infraspinatus, impression for the teres minor. So from above downward, there are three insertion on the superior aspect. First impression for the insertion of the supraspinatus. Second insertion is infraspinatus, and third is teres minor. So this is the three impression. Now attachment on the medial lip of bicipital groove. This is the medial lip of bicipital groove. So this is the medial lip of bicipital groove. The medial lip of bicipital groove will provide the insertion of teres major muscles. Teres major muscles. Now this is the lateral lip of bicipital groove. So this lateral lip of bicipital groove will provide the insertion of this lateral side of the bicipital groove will provide the insertion of the pectoralis major muscle. In between the two major, this is the floor of bicipital groove. The floor will provide the insertion of the latissimus dorsi. So this is the two major in between the lady between the two major. On the medial lip, here is a teres major. On the lateral lip, this is the pectoralis major. In between the two major, here is a latissimus dorsi. So this is the upper end of the humerus. Now this is at the middle of the anterior border. Here is a V-shaped deltoid tuberosity. This is the V-shape. This is the V-shaped deltoid tuberosity. This V-shaped deltoid tuberosity will provide the insertion of the deltoid muscles. The deltoid muscles belongs to the scapular region or shoulder region. So this is the V-shaped deltoid tuberosity present at the middle of the anterior aspect of the anterior border of the humerus. So this V-shaped deltoid tuberosity will provide the insertion of the deltoid muscles. Just in front of the deltoid tuberosity on the medial border, here is a rough impression. This is the impression for the insertion of the coracobrachialis muscle. So on the medial border, at middle of the medial border, here is the insertion of the coracobrachialis. Now the lower part, lower one third is also known as the origin end of the humerus. So on the lower part of the anterolateral surface and the lower part of the anterolateral surface, so here is a origin of the brachialis muscles. So this is the brachialis muscle. The brachialis muscles arise from the lower part of the anterolateral medial surface and the lower part of the anterolateral surface of the shaft of humerus. So here is a brachialis. The brachialis arises from the lower part of the anterolateral, anteromedial, and this is the anterolateral and anteromedial surface of the shaft of humerus. Now this is the two condyles. This is a large elevation on the medial aspect of the lower end. So here on the anterior aspect of the medial condyle, here is the attachment or origin. This is the origin of pronator teres, humeral head of the pronator teres. So this is the pronator teres, and the tip of the medial condyle. This is the common origin of the flexor muscles. This is the common origin of flexor muscle. This is the pronator teres, and here is the common origin of flexor muscles. Now on the lateral side of the lower end, this is the lateral supraepicondylar ridge. Lateral supraepicondylar ridge divided in the two part. This is the whole is lateral supraepicondylar ridge. Lateral supraepicondylar ridge divided in the two part. Upper two-third. Upper two-third will provide the origin. Upper two-third, this is the upper two-third, will provide the origin of the brachioradialis, and the lower one-third, here is the lower one-third, this is the lower one-third. The lower one-third of lateral supraepicondylar ridge will provide the origin of extensor carpi radialis longus. So again, from above downward, on the lateral supraepicondylar ridge, upper two-third, this is the brachioradialis, this is the brachioradialis, and the lower one-third, this is the extensor carpi radialis longus. On the posterior aspect of the lateral condyles, here is the origin of the anconeus muscles. These three muscles, brachioradialis, extensor carpi radialis longus, and anconeus, these muscles belongs to the extensor compartment of forearm. Now, this is on the posterior surface. This is the posterior surface. So this is the oblique groove. Here is the oblique groove on the posterior aspect. This is the oblique groove. So on the upper part of the posterior surface, here is the lateral head of the origin of the lateral head of the triceps muscles. Here is the origin of the lateral head of triceps muscle. So this is the lateral head of triceps just above the radial groove on the posterior surface of the shaft of humerus, and just below the radial groove, this is the radial groove, just below the radial groove on the posterior aspect, this is the medial head of tricep. So the two head of the triceps arise from